and Mr. Li Yang, Deputy Director of the Disease Prevention and Control Center in Hubei. First, we'd like to give the floor to Mr. Li Yang. By the 16th of April, across the Hubei province, the cumulative reported case of COVID-19 is reaching 68,000 cases, among which 53,000 of them is coming from Wuhan, with an increase of 355, and there are 11,000 different confirmed cases in other different cities outside Wuhan. By the 17th of April, there is no newly added cases within 24 hours, and there is no reported imported cases. And for the consecutive 40 days outside of Wuhan, there is no newly added cases. By the 16th of April, there are still 129 patients in the hospital, with 15 patients in the severe cases and 17 patients in the critical conditions. By the 16th of April, the total death toll across the province is reaching 4,512 cases, among which there are 3,800 from Wuhan city, and the newly added case is around 300. Currently, we have discharged around 68,000 cases, among which 45,000 of them is coming from Wuhan. By the 16th of April, all of the newly added cases is coming from Wuhan. By the 16th of April, the newly added asymptomatic patient in the province is confirmed to be 32 cases, and we have also resolved the medical monitoring for 42 cases. That is the end of my briefing. Thank you. Right now, we'd like to give the floor to Mr. Yi to give us an introduction about the blood donation across the province. Dear friends from media, good afternoon. After the outbreak of COVID-19, the Hubei Provincial Health Commission has fully implemented the requirement of the CPC Central Committee and the central governments with the help from other different provinces. We have launched a campaign of blood donations, and we have also conducted a series of the NAT testing for the COVID-19, and we have also put forward the campaigns to collect the plasmas of the recovered patients. Currently, we have supplied the red blood cells in 21,000 units, and the blood plates reported to be 43,000 millimeters, and that is how we are guaranteeing the clinical requirement. Firstly, we are trying our best to guarantee the clinical requirements. After we have initiated the Level 1 emergency response in Hubei province, the provincial government has urged a steadfast guarantee of blood, and we have initiated and started the blood guaranteeing alarm. By allocating all kinds of the resources together, the National Health Commission has focusing on building one mechanism across the countries. By the 16th of January, the National Health Committee is publishing a guideline of the blood donations and supplies in Hubei, and in that guideline, Anhui, Hunan, Jiangxi, Sichuan, Yunnan, among other 9 different provinces, is supporting all kinds of the blood to the province, and for the other kindly provinces, all of their blood collectors is working at the forefront, and their blood donation has eased the urgent gap between the supply and demand of our province. By the end of the 15th April, other provinces has donated around 46,000 units of the red blood cell, and 1,800 of the red blood cell platelets. Secondly, we have also working up to guaranteeing the safety blood supply. During the outbreak, the blood is also serves as a very important element, just as important as the PPEs and ventilators. Our provincial government has published a new guideline of the testings and qualifying the blood donation. And for those who donate their blood during their outbreak, we have also added the NAT testing together with the plasma testing and the serology testing. Currently, we have tested around 59,000 different samples. Thirdly, we have also put forward the scientific transitions of blood donations. During the outbreak, we are also working together with the different hospitals and medical institutions. And we have built up a reasonable system to make sure that all the blood is donated in an apt manner. We have also adjusted the blood donation system, and that is how we are controlling the blood supply and demand into a dynamic balance. And to our maximum, we guarantee all the patients in the urgent need of blood get a prompt treat. For our center, we have also focusing on the clinical usage of the blood, while doing a very good job at the blood quality testing, putting forward the new technologies and its translations and implementations. We have also designed an appointment system for the clinical surgery, and we want every single drop of the blood to be used in a precise manner. Fourthly, we have intensified our effort in the blood plasma collections to gather more momentum for the recoveries and treatment of the patients of the COVID-19. The CDC Hubei has applied the guidelines of the collections of the plasma at the first time, and we have came up with the procedures at the clinical stage. Across the province, at the national level, all the experts have given us all the support through the telecommunications, and we have also initiated a campaign to activate all the recovered cases to donate their blood plasma. We have built up 19 different blood collecting points, and so far we have collected the blood plasma from 1,200 different recovering patients, and in total providing 43,000 liters of the blood plasma, and this is also providing more samples for the clinical research. So here, borrowing this opportunity on behalf of the National Health Committee, Hubei provincial subsidiaries, we'd like to show our gratifications for your blood donations and for your kindly support. Thank you. Now the floor is open for questions. Please identify yourself before the questions. With people's daily, during the outbreak of the COVID-19, the collections of the blood is in an urgent demand. So how did the National Health Commission Hubei provincial subsidiaries did your blood collection job? Thank you. Thank you very much for your question. Since our country is building up a blood donation system, all the kindly public people is willing to donate their blood to cure and help these people in urgent demand. This is a behavior which is widely adopted across all works of the society. And during the outbreak of the COVID-19, because of the social distancing, this has brought a lot of difficulties to the blood donations. At the most difficult times, the blood inventories can only support the Hubei province for 2 to 3 days. tackling these challenges, our institution is stepping up effort. First, we have been led by the Hubei Provincial Health Committees, and we have built up a urgent guaranteeing system in the blood supply and control. And we have intensified the blood donations between the different institutions. And we have also focusing on the plasma collections for those recovered patients. And during the blood donations, we have also stepped up effort in the NAT testings and PCR testing. Secondly, we have also implemented all kinds of the recruitment and enrollment strategies, and we are focusing on the 5 different fronts. We are using the media and social media, news, with all kinds of the channels to give the general public a knowledge of the blood donation. And this is actually ease the burden of the blood donation. And we are also working at different parts of the society by publishing all kinds of the guidelines. We have used the channels, green channels of the blood donation to activate all walks of life to donate their blood. Thirdly, we are also working on different institutions and organizing the governmental staffs and institutional workers to donate them their blood. Fourthly, grassroots activation. We have working together with the different streets and communities to activate more donors in these different areas. And we are using the telephones and internet to recruit more blood donations through non-appointment stages. And we are also providing registered vehicles to guarantee the health of the blood donors. Thirdly, we are also stepping up our effort in the coordinations across the province. At the very initial stage of the outbreak and at the late stage of the outbreak, we have launched several different campaigns of the blood donations, and we are calling for the national support of to Wuhan. During this hard time, the National Health Committee is calling for 9 different provinces to support our province with the support across the country. All the blood is gathered in Hubei and even in Wuhan. We have also conducted different coordination mechanisms by rationalizing the blood, balancing the different blood demand in the blood collections, blood supplies, blood transfer, and blood usage. And that is how we are going to guarantee the treatment of the COVID-19 patients. Thank you. With economic delay, during the outbreak of the COVID-19, Wuhan Blood Center, how did you guarantee the clinical usage of the blood and healthy quality control of the blood? Thank you very much for your question. The outbreak of this pandemic is the largest difficulties that we are encountered so far. Since the outbreak of the COVID-19, we are launching works in the 4 fronts. Firstly, we are building up a scientific-based mechanism. Wuhan Blood Center is working together with all kinds of the prevention and control centers, and we have given a very rational analysis of the clinical status in Wuhan under the support of the National Health Committees. We have built up a mechanism by safely collecting it from Wuhan while transferring some of the blood samples from other different provinces. Secondly, we have also shifted our work focus into those blood donors who are donating their blood for several different times by arranging vehicles to fetch them up. We have make around 60,000 appointment calls, and we have transferred over 10,000 different blood donors. And the total blood plate we have collected is covering 8,300 people. The total collections of the plate is guaranteeing around 78% of the clinical usage across the province. Thirdly, we have also working together with other different provinces for the national health commissions. By the February 26th, they have launched a guideline to initiate Henan, Hunan, Anhui, Yunnan, Hebei, Sichuan, among other 6 provinces, to transfer their blood inventories into Wuhan. By the 15th of April, the total transferred red blood cell is reaching 3,360 units, and the blood plates is reaching 1,800 units. Fourthly, we are guaranteeing the safety of the blood while guaranteeing the safety of our personnel. In the Wuhan city, we are launching a joint mechanisms of coordination of prevention and control. We are also keep the sterilizations of the environment. On the other hand, from the very root, we have built up a scrutinizing mechanism for the blood donation. And all the blood delivery is going to be postponed for 14 days, and we have also conducted the NAT and RT-PCR testing for the blood donation samples. That is how we are guaranteeing the safety of the blood. By the 15th of April, Wuhan Blood Center is providing around 54,000 different samples of the red blood cells and 47,000 units of the blood plates. We hope that for all of these adults between the 18 years old to 56 years old could join our campaign of the free blood donation. The people of Wuhan is a group of the heroes, and I hope that all of you could counter our effort to help the city to restore its energy. Thank you very much. With Pengpai News, my question is that are there any people around you who will participate in the blood donation during the outbreak? How do you feel about the blood donation during the outbreak? Can you share us your experience? Thank you. Thank you very much for your question. So for friends and people around me, there are so many blood donators. They are the people who are enlightening the city of Wuhan in a humble manner. During the outbreak of the COVID-19, there are so many patients who are in an urgent need of the blood, apart from the COVID-19 patients. So I think that all of the volunteers, together with me, they understand the urgent demand of the blood supply. So all of these blood donators are just ordinary you and me. You ask about our feelings about the blood donation. I think the most severe feelings I have is fear. But I know that the blood we donated is for the rescuer of life. For example, the second day after the New Year's Eve, I remembered that was a quite cold day. And with the suspensions of the transportation, I think nobody is going to donate their blood. To my surprise, in the Department of Hematology, I find so many old faces. Some of them work to the hospital for several different miles to be a part of the blood donation. They even lie to their families since they are outdoors. Many people don't understand why we are doing this. But let me quote from one of my friends. My city is in danger. The blood cannot be inadequate for one day. At this moment, it needs our efforts. Later on, the Wuhan Blood Center is providing all kinds of the vehicles transferring us from our home to the donation center. Just as Director Wang has introduced, all the blood that we donated in Wuhan can satisfy the 80% of the demand in the hospital. As a volunteer, I'm so proud of the result that we have achieved, and I also believe that all of these volunteers' spirit of the donations is going to make Wuhan a better city. Thank you. With Hubei Daily. During the outbreak of COVID-19, many different blood donors is actively donating their blood, providing a rare resources in the battle against COVID-19. What is the government's measures to help them during this campaign? Thank you very much for your question. Blood donation is a demonstration and motto of the love in the human society. During the outbreak, I think one thing moves me most is that the blood donors is working against the tide of the time, and they are providing a very steadfast guarantee for the clinical emergency treatment. For those of the recovered patients of the COVID-19, they donated their blood plasma, and this has helped us rescue many different lives. I can call them the loveliest people in the new era. The promotions of the blood donation and its key area is to care about the blood donors. The care and concern for them is demonstrated at our respect toward them. From the free usage of the blood for all of these blood donors, the care for all of these blood donors should be goes into details as well as comprehensive, and this should be put into the real practice. That is how we are going to help them to guarantee respect for all of them. By fully playing the role of the governments, we have promoted the campaign of the blood donation, and we have also ratified measures to activate blood donation. And we have also launched a series of the government policies of the blood donation resources. For example, we can provide them free health examinations and giving them green channels when they are taking up the public transportation. And we can also provide a comprehensive, all-rounded support for the blood donors. That is how we are going to show our respect for the blood donors. And we have also gathered all the media explorers for all of them. And this is helping all of the blood donors to have a spiritual sense of the achievement. This is going to help the whole society build up a very good atmosphere for blood donation. Thirdly, we are also working on the scientific promotions, and we believe that the blood donation should be a part of the compulsory education. Blood donation is going to be a voluntary act of the general public. This year marks the 17th year of the World Blood Donation Day. We are going to praise these blood donors during the COVID-19. For all of these donors who donated their blood plasmas, and this is going to help the whole society to respect each other in a moral manner. So here I'm calling for all of these heroic people in Wuhan. Please protect yourself in a scientific manner, and please be a part of our blood donation campaign. Thank you very much. With Chujing Metropolis Daily. So what is the working result of the collections of the blood plasmas from the recovered patient? Thank you very much for your question. The blood plasma is one important and effective measure to tackle against the COVID-19 virus. According to the general plans, Wuhan Blood Center cares about the blood collections, and we have following up our effort in the 3 different areas. First, we are focusing on the scientific research, and we believe that the plasma treatment is the most effective measures. At the beginning of January, the Wuhan Blood Center is working together with the Chinese Academy of Science and Chinese Academy of Engineering, and we were setting up the clinical treatment plans for the recovered patient blood plasma. By the January the 1st, we have collected the blood plasma for the first time, and at the 9th of February, we have conducted the first research by injecting the recovered blood plasma to the patient, and we are launching a kind of the research of the clinical usage of the blood plasma. Secondly, we have undertaken a task to guaranteeing the blood plasmas. By the 13th of February, Wuhan Blood Center has increased the donation and the collection point into the number of 5, and Wuhan Blood Center is undertaking the missions of the blood collections, blood testings, blood plasma formations, and blood plasma usage. We have formed a special team of 18 different experts focusing on these four fronts of the work. By today, in the city of Wuhan, in the total number, we have treated and used around 83,000 liters of the blood plasma, and this plasma is being used on over 500 different patients. Thirdly, we are stepping up our effort into the clinical usage. For all of these clinical institutions and hospitals who are using the blood plasma to treat their patients, we are creating a research campaign, and we are actually also wrapping up our effort in the information sharing platform, and that is how we are going to guarantee that this is going to be a scientific and standardized mechanism. Thank you. With Changjiang Yangtze River Cloud, you mentioned about the blood donations. What is the biggest difference between the blood donation voluntary work together with other volunteers' activities? What is the difficulties that you were facing? Thank you very much for your question. Blood donation is a fundamental question for the clinical usage of the blood, and it needs the constant effort from all people across all walks of life. So it is have a wider coverage. In Wuhan, we have built up a free blood donation organization. We are not only working at the voluntary works, but we are also launching a series of the campaigns. We are going to the university campus, governmental institutions, and even goes to the different villages. We are using our first-hand experience to show to the general public about the knowledge of the blood donations, and we were asking for the suggestions of the blood donation. By working together with the blood center during the outbreak, since everybody is stay at home, so our promotion and campaign is facing all kinds of the difficulties. In order to tackle the difficulties posed by the COVID-19, we have shifted our way of thinking and transferred it into an online promotion through the WeChat group and the QQ group. We were answering questions for more people, and we extended our warm hand to more people. Under the leadership of the Wuhan Health Commissions, there are more blood donations in the street, and at that time, we were starting to recruit the blood donators. Within a short period of 2 hours, there are over 20 people who are signing up for this campaign. And after that, all of them is working at the 11 blood donation spots across the city of Wuhan, and they were giving all kinds of the guidance, and they were also dispatching the gifts and certifications and doing all kinds of the voluntary works to the blood donators. The Wuhan Blood Donation Organization is an organization under the leadership of the Ministry of the Civil Society. If you care about the blood donations and if you want to be a part of this campaign, we welcome all of you to be a part of us. Thank you. Thank you very much for all of your questions. With that, we conclude today's press conference.